Welcome to another edition of A New Me, your weekly consultation with the Washington, D.C. area's best doctors and professionals. Our guest experts help you learn about the latest medical advances and procedures by providing you with the real information necessary to help you eliminate the dangers of making the wrong medical and cosmetic enhancement decisions. Get ready for your consultation. Coming up, we will be on location in Fairfax, Virginia, discussing the latest advances in cancer diagnosis and treatment and how they can help you win the fight against cancer with one of this area's top oncologists, Dr. Padma Kamineni. Dr. Kamineni received her residency and fellowship in hematology and medical oncology at Howard University Hospital in Washington, D.C. She is a member of the American Society of Clinical Oncology and is widely recognized as one of this region's top oncologists. Welcome, Dr. Kamineni. It's a pleasure to have you on our program.
Nice to be here.
We have a lot to talk about. We've got some patients that are going to be coming up a bit later, but I wanted to begin, if I may, by asking you, Doctor, if you can please tell us about what are some of the most common types of cancer that you see in your patients.
Well, the most common types of cancer we see in our practice are lung, breast, colon, prostate, lymphoma, and gynecological cancers. And also, to a certain extent, we do see blood cancers too.
You do? Oh, okay. Very interesting. Now, how is the diagnosis performed for these?
Depending on the symptoms and examination findings, we will arrange for the diagnostic tests, including laboratory testing, imaging studies, and however, tissue is the issue here. We will confirm the diagnosis by biopsy, in certain cases by removing the whole tumor.
And then how long would it take to get the results back from these tests so we know what the situation is?
Usually it takes 1 to 2 days to get the preliminary results. But however, depending on the complexity of the case, sometimes it even take up to 10 days.
Okay, so it's pretty quick. Generally 1 or 2, like you said.
The preliminary report takes
Yes.
1 to 2 days.
Okay.
But the final results sometimes even take up to 10 days.
Okay, and I appreciate you letting us know that, Dr. Kamineni. And I wanted to ask you also about the stages that we hear about when you're talking about cancer. There are stages of cancer, and certainly depending on which stage we're diagnosed at, tells us a lot about, and you being the doctor, about what needs to be done and what we're looking at moving forward.
Sure. The TNM system is the widely used staging system. Okay. T stands for tumor. It can be tumor size or extent of the tumor. N stands for lymph node involvement, and M stands for metastasis. Okay. Metastasis is defined as spreading of the cancer to other parts of the body. And most of the common cancers are staged as stage 0, 1, 2, 3, or stage 4.
And obviously, stage 0 and 1, if we have to have that dreaded word cancer show up from the testing, then stage 0 and 1, I would take it, are the ones that are at the very early stages.
Early stages, and 4 being the most advanced stage.
Yes.
Some cancer doesn't even have staging system. And some cancers, we incorporate the serum tumor markers, such as testicular cancers. Yes. We use the serum tumor markers in the staging system.
Very interesting. Yes. What are some of the latest treatment options that can be utilized against cancer?
Due to improvement in the diagnosis and the treatment, more people are surviving cancer than before. There are about 12 million cancer survivors today. Let's talk about targeted therapies in lung cancer. Lung cancer is one of the most leading cause of cancer deaths worldwide. Based on the patient's disease condition and the tumor characteristics, we start the patient on targeted therapies. One of the targeted therapies I'm mentioning in lung cancer is erlotinib. This is the targeted therapy we use in EGFR mutated patients. Similarly, the second targeted therapy we are using is ALK inhibitor. It inhibits the something called ELM4 ALK translocation. Thereby, we are seeing more response rates and more improvement in the symptom control, improving the patient quality of life.
That's a significant number. Yes, indeed. Yeah. And obviously that's due to the latest effective treatment options that are now available. And can you elaborate on that for us, doctor?
Sure. Common treatment modalities include surgery, radiation therapy, chemotherapy, biological or targeted therapies, or combination of these. In our medical oncology field, especially several advancements have happened in this decade, especially cutting edge targeted therapies and improved chemotherapies. Other than traditional chemotherapies, we are incorporating more and more targeted therapies based on molecular diagnostic testing.
And how are some of these treatment options performed, doctor?
Chemotherapies or targeted therapies can be given orally, subcutaneously, intramuscularly, or intravenous form.
And what would you say is the success rate that you found against cancer with these various treatment options?
Very good question. The success rate depends on various factors, depending on the type of the tumor, stage of the tumor, and the tumor response to the treatment. Highest success rates are seen in seminomas, hairy cell leukemias, and some lymphomas.
We're now going to meet some patients of Dr. Kamineni. Welcome, Pamela. Oh, it's our pleasure to have you on. We always appreciate it when patients take time in their busy lives to come down and share some of their experiences with us. And on that note, I'd like to begin, Pamela, by asking you if you can please tell us what problem or problems were you experiencing prior to coming to Dr. Kamineni?
I was diagnosed with breast cancer about 13 and a half years ago. The insurance that I had no longer was my job, so I had to join another insurance, Aetna. So I went to an OBGYN office and they recommend Fairfax or Dr. Kamineni because she felt a lump on the side of my breast that I had before.
So that's what happened when you were at the OBGYN.
Right.
And then she recommended Dr. Kamineni for you to come and visit with her.
Right.
So then what happened once you came here?
When I came here, I was scared. I didn't know a clue. She just said that it was a fatty tissue. And she had every exam, the pap smear, the mammogram, CAT scan, every scan that she can think of, examine me to make sure that it wasn't cancer again.
Okay.
And when the results came back, it was cancer.
Oh.
And because she went further.
Okay.
In her,
so the initial testing did not pick up cancer.
No.
With the fatty tissue.
Exactly.
That the OBGYN originally had diagnosed. And so then you came here, you went through extensive testing, which did determine that you had cancer again. It had come back.
Right. Dr. Kamineni went further.
Okay. So then what happened after that?
What happened was she had told me what she was planning to do step by step, and that was to go through different types of my surgeon. Dr. Burgess is my surgeon of Virginia Surgery Department, and I will have to have radiation.
Okay.
Which I never had before. The radiation was Dr. Chella in Fairfax.
Okay.
So all three doctors was phenomenal, fabulous, and well taken care of.
So you went through the radiation treatments.
Yes.
Obviously, Dr. Kamineni played a huge role in finding out through extensive testing that you did have cancer.
Yes.
And then you went through the radiation treatments. And you know how long, can you tell us how long they took, or you went through them?
I went through Dr. Kamineni for 6 months for the treatment. I was stage 3. And I went, Dr. Burgess took me right in. It took like 3 days. After they found out that I had this, he took me right in right away and had this, the surgery and everything. And Dr. Challa, after everything was over, and I went through the radiation, and it everything went swell.
Oh, I'm so happy to hear that. Thank God. And
Thank
obviously you're very pleased
Yes.
You're fine now.
Thank
Right?
God.
And I'm sure your significant others are ecstatic as well.
Yes.
And the folks out there that are watching, Pamela, what would you tell them about Dr. Kamineni and her staff here?
It's so much to tell. I can't even write it down or describe, but she's phenomenal, fabulous. She's everything. I just thank God I gave her a gift to help people, and she's one of a kind. She's more than what she normally does is take care of a patient, but she goes further. Even when you're feeling bad, she will call you to see how you're doing, how you feel. If you're not feeling well, she will describe something for you to make sure you feel better.
Yes.
I mean, I just thank God for her.
Wow. That says it all right there, and you're cancer-free.
Cancer-free.
That's right. And on that note, I'd like to thank you, Pamela,
Thank you.
for sharing your experience with us.
No problem.
Our pleasure.
You're welcome.
It's a pleasure to have you with us as well, Nader. Welcome to our program.
Thank you. Nice to be here.
Now, I wanted to begin by asking you what I just asked Pamela a few minutes ago, and that is, what problem were you experiencing that brought you to Dr. Kamineni?
About a year before that, I was experiencing bruises. It happened all over my body with no reason.
Oh my goodness,
And
just for
then-
no reason you were
just
getting
for no
bruises
reason,
in different
all
parts of your
over.
body were showing up?
Yes.
Okay.
And then I went to my general practitioner for several of the tests, but it was no answer. And then I was recommended to come Dr. Kamineni.
Okay.
And then she asked me about my health history, and I told her that. And then she decided to do a bone marrow test on me.
Oh.
And she did a blood test and a bone marrow test, and then the result was I was diagnosed with leukemia.
Oh my goodness.
And it was 12% the day she told me, and she said 20% is stage 4, but you're in its earlier stages.
Okay.
And then she recommended for 6-month chemotherapy.
Now, let me backtrack for just one moment for folks out there who may be in a similar situation to where you were a little while back.
Sure.
Did these bruises, did you find just a couple here and there, or were they over a period of time? Were they staying with you? If you could maybe elaborate a little bit.
As one was fainting away, the other one would appear somewhere else.
Different body part.
Different body
My
parts,
goodness.
from legs and all over to my shoulder, my
Okay.
chest, and all that.
Okay, so I appreciate you letting us know
No
that.
problem.
So then you went through the chemotherapy.
Yes.
After Dr. Kamineni had diagnosed you had leukemia.
Yes.
And then how many treatments did you
She
go through?
recommended. She has recommended for 6 months.
Okay.
Each month, 5 days follow.
Okay.
And on I started, I think, December. Because
Okay.
I was diagnosed in early November,
All right.
and she wants to start the procedure as soon as possible. So we did that in the first coming month, which was month of December,
Okay.
and then recently on the third one, before the third one, she did another bone marrow test,
Okay.
and it was down to 2.75.
Oh my goodness!
Yeah.
Wonderful
It was a
news.
very good news.
So the chemotherapy was working just after the first few treatments. You already had decreased from 12% on the leukemia through the
To
testing down to 2.5%.
2.75.
That's wonderful.
It was a wonderful news.
That's got, oh my
Yeah.
God, just to see
Yeah.
that, I'm sure you were very, very nervous waiting upon those test results
Absolutely.
to see just how the treatments were progressing.
Absolutely.
So then what happened? You went through some more treatments and...
Yeah, I took the fourth one, and I have 2 more to do,
Okay,
which would be by the end of the April will be the last one.
okay.
And then I believe she's going to take another bone marrow and compare the result with others she has.
So it's basically one chemotherapy treatment a month
Yes.
over a 6-month period. That was her
Exactly.
recommended treatment
It's a
schedule.
5 days treatment.
Oh, it's over
every
5
month,
days.
Yeah.
Okay. Now I appreciate you letting
5
us
days
know
on
that.
the row.
Okay.
You know, we usually start Monday and it ends on Friday.
And how long does it take for each
Usually
one?
it takes between 2.5 to 3 hours because
Okay.
it's a injection type by serum,
Okay.
and they have put the port in my chest,
Okay.
so it goes from there, and it works very well.
Well, to hear that it's down from 12% to a little over 2, and hopefully with the remaining couple of treatments that you have, you're gonna be cancer free.
That's what I believe.
That's right.
What I'm going for.
Yes. And on that note, before I let you go, Nader, for the viewers out there that are watching, what would you tell them about Dr. Kamineni and her staff?
Oh, I think Dr. Kamineni, she's an angel.
Oh.
She builds the trust in you without talking about it, and you will feel it in your core. Nobody has to say anything. And as far as their staff, they are so wonderful. They are so beautiful. You don't feel outside of your home when you come here.
Yes, it's like a family.
Exactly.
They're right there for
Exactly.
you.
Haven't been honestly haven't got this type of treatment anywhere else,
Yes.
in any other doctor's office than I get here.
Well, Nader,
It's wonderful.
on that note, I'd like to thank you very much for coming down and sharing your experience. And you're almost cancer-free. A couple more treatments to go, and through God's grace, you will be.
Sure, thank you very
Okay?
much. I appreciate
Thank
your time.
you. Our pleasure. It's great to have you on as well, Ranjana. Thank you for joining us.
Thank you for having me here.
Oh,
It's a
pleasure.
pleasure sharing my journey with
Oh.
cancer.
Oh, and I wanted to begin by asking you what brought you to Dr. Kamineni.
Well, it all started on October 4th, 2010, and I ended up at 7:30 in the morning with excruciating pain. I was doubled over. My husband called 911.
Oh my God!
And I was taken to Fairfax Hospital emergency room.
Where was the pain, Ranjana?
It was lower abdominal pain.
Okay.
It was a cramping that I cannot even describe.
Oh my God!
It was so intense.
So then, what happened when you were brought
I was
emergency?
brought in, and they tried to stabilize the pain. I was given morphine, enough to control my pain, so they could take me to get a CT scan
Okay.
because they needed to know what was causing the pain.
Yes.
When I saw the doctor again, he said he had the results and he had contacted one of the best oncologists in this area, and she'll be in to see me and talk to me about what the CT scan's all about.
So then Dr. Kamineni came in and met with you.
Yes.
And what happened at that point?
She told me, well, the minute I saw her, I had been there one night already at Fairfax Hospital,
Okay.
and you know, all through the night, because the doctor on call had said that it was he was contacting an oncologist. We instantly knew it had something to do with cancer.
Yes.
It was a little overwhelming, and so I was awake most of the night, trying to get my pain under control. And my husband was with me, and we started praying.
Yes.
And the minute I saw Dr. Kamineni enter my hospital room, I knew my prayers were answered.
You just felt that comfort, that
It's
soothing feeling.
not just soothing, it was like she was sent to me for a reason.
Yes.
It was like a guardian angel. She was gonna help me. Because at this time, you know, I didn't know what stage I was in. I just knew I had cancer.
Yes. So then, what stage did she indicate to you that
Well,
you were?
after she looked over my CT scan, she didn't skip a beat. She immediately talked about getting a biopsy for my liver to make sure that what she was, you know, expecting to get, which was a diagnosis of cancer,
Yeah.
but what kind is what she needed. So she contacted Dr. Nethamer, who's a interventional radiologist, a wonderful and talented man.
Yes. Yeah.
And he basically talked to me about what kind of treatment he was going to do for me.
Yes.
And the reason Dr. Kamineni contacted him was because he basically dealt with radioactive spheres that needed to be injected into my liver. I found out I was in stage 4 at that time because it had metastasized to my liver. What I have is neoendocrine carcinoid tumors.
Okay.
And it had grown into my peritoneal cavity on the outside of my colon.
Oh my God.
So I had to go through surgery. And again, Dr. Kamineni came through like, I don't know how to explain it. I get overwhelmed when I talk about how she came into my life. She suggested Dr. Stevie's, who's one of the most well-known surgeons, oncology surgeons at the Washington Hospital Center,
Yes.
the Cancer Center. And basically, it was a matter of getting the colon resectioned. He did the ostomy bag for me, did the reversal surgery.
Yes.
But Dr. Kamineni just jumped in and said, we have to stop this cancer in its track. I'm going to put you on octreotide. I hope I'm saying it correctly, because it's a sandostatin LAR. It's a inhibitor.
Yes.
I was feeling a lot of symptoms. This cancer mimics other illnesses, and one of them is menopausal symptoms of hot flashes. And the whole time I had another insurance company. I won't mention any names, but they were diagnosing me as premenopausal symptoms, and the whole time I had this tumor growing inside of me.
My goodness,
It hadn't been caught.
That's how it advanced to...
It advanced to stage 4.
Stage
It had
4,
been
yes.
caught since I'm 56 now, but I was 46, 47 when this whole thing got started.
My goodness.
Yes.
So basically, you would have been, obviously, if the proper testing had been done at that
Right.
time,
Right.
this would have been nipped in the bud.
Right.
Instead, it had advanced to stage 4.
Right.
And at the, Dr. Kamineni, working in conjunction with the other...
doctors that
Yes.
she selected and the program. She was like my quarterback. I would call
Oh
her my
my
quarterback.
God.
Because she arranged all my treatment
Yes.
and handpicked the doctors that would, help me on this journey with her.
Yes.
Because it took a special team of people to help
take
me.
to take care of
Yes.
this.
Yes.
And I take it, it's a success?
Oh my gosh, yes. The radioactive embolization of my liver has stopped all the tumors in its tracks.
Wonderful.
It hasn't disappeared. It will shrink in time,
Yes.
but it's not causing me any problems now. As far as my treatment goes, I just started chemo. This is, I feel like, the last stage of my treatment, in which I can finally see a little bit of light at the end of the tunnel.
Yes, that's right.
And thanks to Dr. Kamineni, her staff, her partner, Dr. Chirla. Without them, I don't know how I would have made it through. They made a very frightening thing less fearful for me.
Yes, that's the most frightening thing. Right up there, put it that way.
Yes.
Nobody ever goes into life or lives life and grows through life ever thinking or expecting a bombshell like that dropped on
Absolutely.
them. And to hear how Dr. Kamineni and her staff and her partner, all of them together really did wonderful
Walking in
job.
here is like walking into my family's living room or something.
Yes.
They take such good care. The TLC is beyond belief. And I am truly indebted to them for my life.
Yes.
My family is indebted, actually.
Yes. Well,
Because
I think
I have 2 boys.
Oh.
I have a lot of life to live yet.
yes, indeed, and you're going to live a lot of life through God's grace.
Absolutely.
And their mommy, really, they're going to have her for many more years.
Oh,
And-
I hope so.
Yes.
They're 24 and 21 now. It'll be 22 soon.
Yes.
So, I still have
You
to be
got
a grandma.
Yes, you still have to go through all that,
Yes.
and to give them all the TLC,
There
your
you go.
grandkids.
There you
But
go.
I really want to thank you, really very much for coming down, sharing your experience, and being a guest on our program.
It was my pleasure.
Oh.
Thank you for having me.
Thank you.
We are now back with the doctor. The patients certainly seem very pleased with the results. The work that you're doing here is literally like an angel from God. You are saving people's lives, certainly improving their lives and giving them a real chance to make it forward through these various effective treatment options that we've discussed today.
Sure.
I wanted to ask you, Dr. Kamineni, are there any side effects
from some of these treatment options that we've talked about?
Sure. With improvement in chemotherapies and targeted therapies, we are seeing fewer side effects. Side effects vary from person to person. Some patients tolerate chemotherapy very well without any side effects. Usual side effects we see are nausea, vomiting, fatigue. Other side effects include diarrhea, constipation, skin rash, sexual dysfunction, memory difficulties, sleep disturbances, bone marrow suppression leading to cytopenias and infection.
So that's what we're looking at as far as possible side effects from the chemotherapy.
That's right.
Now, what is the chance of the cancer coming back? Say one of these treatment options, or in conjunction, a few of them, as you said, sometimes you can incorporate different modalities, different treatment options, depending on the cancer and the stage it's at, to effectively treat it. What are the percentages in general terms of cancer coming back once it's been removed?
Many factors play a role, including type of the cancer, stage of the tumor, and also the risk factors. If you take an example, in breast cancer, most of the breast cancer recurrences occur within 2 to 3 years of treatment.
Oh.
And these recurrences are more common in younger age groups. And also, chances of recurrences in breast cancer depend on the size of the tumor, lymph node involvement, lymphovascular invasion, multicentricity of the tumor, and also margin involvement.
Now, we're literally out of time, Dr. Kamineni, and this has certainly been a very formative interview. I wanted to ask you, because your practice here in Fairfax, Virginia, have certainly developed a reputation for excellence. You're recognized widely as one of this region's top oncologists. And I wanted to ask you, what would you say helps separate you and your practice apart from so many of the others?
When a patient is diagnosed with cancer, it's huge stress to the patient, both physically and psychologically.
Yeah.
They're worried and anxious. We spend time with the patients and their families to go over the treatment options.
You all, that's what we found from our research, really place a strong emphasis on patient care, understandably so, based on what you just touched on there, because this isn't like going to a dentist or having some minor, a cosmetic procedure. We're talking about one's life and the impact of that on all the significant others within that person's life. So I can't even imagine what not only the individual would go through once they have been updated and told that they have cancer, but at the same time the impact and toll it takes on everyone that's associated with them. So patient care is got to be of the vital importance.
You are right. Our goal is to cure the cancer, but in certain cases, if it is not possible, our goal is to prolong the patient life and improve quality of life. In our practice, we work as a team to provide personalized care to the patients and be available all the time to our patients. Our support staff is very caring and compassionate in taking care of our patients.
Yes, indeed.
And we also work in conjunction with other multidisciplinary teams to provide the best patient care.
Certainly from the patients we interviewed today, not to mention from the research that we did prior to this interview, I have to say you're absolutely right, and that's what I would think is definitely some of the major reason, if not reasons, that separates you from so many of the other oncologists around here, because you've developed quite a strong reputation in not only effectively treating cancer, but also in really caring for your patients and going the extra mile, so to speak, to help them through all this along with their families.
Yes.
So on that note, I'd like to thank you, Dr. Kamineni, for joining us, being a guest on our program, and really helping to educate us on very important topic, namely effectively fighting cancer. And we actually have a much better chance today than we certainly did yesterday. Thank you again.
Thank you.